Okay, we have 5 presenters joining us here today. Richard Petty is co-director of ILRU and director of the National Center for Aging and Disability at the Institute for Rehabilitation and Research. He also leads training and technical assistance activities for disability-oriented community organizations with the Aging and Disability Business Institute, with ILRU's partners at the National Association of Area Agencies on Aging, and chairs the Institute's Disability and Aging Work Group. Jennifer Morgan is the Aging and Disability Program Manager at Utah State University and has a lead role at ILRU on the Disability and Aging and ILNet projects. Patricia Yeager has served as Executive Director for 4 CILs and was the first director of the California Foundation for Independent Living Centers. She is currently CEO of the Independence Center in the Pikes Peak area in southern Colorado. Brooke Curtis is a training and technical assistance specialist at ILRU, where she is responsible for assisting with ILRU research projects, managing data, and aiding with training materials and events. Orion Bell is the president and CEO of Sokoa Aging and In-Home Solutions. Sokoa serves the community long-term care needs of older adults, people of any age with disabilities, and family caregivers in Indianapolis and the surrounding counties in central Indiana. And I would like to welcome our presenters here today. Thanks for being here, everyone.
Thanks for having us.
Steve, thank you. And Steve, thank you for that introduction and for organizing our webinar. And everyone, I am Richard Petty, and we're especially pleased that you're here as we unveil the how-to guide for marketing CIL services to health plans and payers. And today we have some learning objectives. Our objectives are to unveil the guide or introduce you to the guide and the guide to you, provide a high-level overview of health plans and payers, how they work, and how they may be interested in the services that your centers offer. And there'll be a point where you'll need to make a business case to them for why they should be interested, and we'll cover that today. We'll cover some initial steps to work with health plans and payers. That's also part of the guide. We'll highlight the linkages between core services and the other services that centers offer and services that are purchased by health plans and payers. We'll also cover today the importance of marketing CIL services to health plans and payers. There are some important advantages for your center, and there are also advantages for those people with disabilities living in your communities. Let's go to slide 7. A little bit of background on the how-to guide. This guide was developed by ILRU. We did that working with our colleagues at the Aging and Disability Business Institute, and most notably, the Disability and Aging Work Group, which was a group comprised of 12 or more individuals representing Centers for Independent Living, other community-based organizations, representing health plans and payers, and other community living experts. And this is a live web document. It's a document that will change over time. We will feature other programs that have been successful in marketing their services to health plans and payers. And there, by the way, will be other webinars in this series where we feature other centers, possibly other organizations too, that have been successful. And today we are featuring 2 organizations that have been notably successful. Both of these organizations were involved in the Disability and Aging Work Group, and they walked this path with us in developing the guide, and we knew their expertise, and we think it's important to learn from any organization that's been successful in this new arena. And the purpose of the guide is to provide some easy-to-follow steps that you can follow in beginning to work with organizations that you may not have worked with previously. That's health plans and payers, of course. We also will, in the guide, help you identify services that will be of interest to health plans and payers. Slide 8. It's important to recognize that Centers for Independent Living have some very important advantages that cause you to be of great interest to health plans and payers. They should be interested in you. You're the community living experts. You understand consumer direction, and consumer direction is the aspect of the work that you do that makes you highly successful in the community. And you understand how to help people with disabilities, and that includes people who age into disability, how to connect to and receive services from community service programs in your communities. You're deeply connected in your communities. You know who's effective and who's not, and you know how to help people get to the places that they must get to receive the community supports that they need. It's very likely that over time you've developed a strong reputation with others in your community, and that reputation will serve you well as you begin to work with health plans and payers. You also have a very solid understanding of how to access the systems and services and programs that will help people with disabilities remain in the community. And it's time now for us to move to our colleague, Jen Morgan, who's one of the principal authors of the guide. She's with the Utah State University Center for Persons with Disabilities. And Jen will cover an overview of health plans and why they may well be interested or should be interested in working with your organization. And part of the business case that you'll make is you're working with them. So Jen, please proceed.
Thank you, Richard. So Centers for Independent Living have a prime opportunity to engage with health plans and develop new contracts with new payers. In the recent years, healthcare organizations are reaching out into the community-based organizations for their expertise to improve service and outcomes to clients. Your agency's roots in consumer direction is an asset and value to partners that you serve. If you could advance the slide, please. There are multiple types of health plans and payers, and it will differ depending on your community, and it will differ from state to state as well. But some of the health plans and payers are Medicaid managed care organizations, accountable care organizations, hospitals or health systems, VA medical centers through the Veteran-Directed Home and Community-Based Services Program, Medicare, Medicaid, Duals Plan, state Medicaid agencies, and commercial health insurance plans. And so it's important to explore and identify who these potential payers, partners are in your community. And then it's important to ask, do these potential partners know who we are and what we do? Because it's very likely that they may not even know that they have such a great resource in your agency to tap into. So educating and marketing your services to health plans and payers provides an opportunity for you to share your strengths and develop that relationship. Next slide. how the health plans are working with Centers for Independent Living and other community-based organization, one of the major drivers for health plans is the impact to health outcomes. So the social determinants of health is defined as a conditions in the places where people live, learn, work, play, affect a wide range of health risks and outcomes. And your work, you're working with individuals on a daily basis and have a great perspective of the needs of your consumers. And that brings a great value to the table. These health plans are working with community-based organizations and provide financial support or reimbursement for services. And many of these organizations say that they have gotten a contract for one or more services. For example, some of these would be for case management, care transition, home care, nutrition programs, person-centered planning, participant-directed care, and transportation, just to name a few. So that gives you kind of a broad idea of there are many ways to tap in to these services that you know quite well. On the next slide, we've got a great input from Patricia Yeager, as she has already been doing this work on this path. And this quote that we have from her is, "We found the director of our local hospital's inpatient rehabilitation unit who was interested in what we were trying to do. He also needed a better process for transitioning people out of the hospital successfully. He became a board member and our biggest cheerleader." And I think that that's really key in the importance of developing that partnership, finding that champion, somebody that is really understand what you do and how it can impact the work that they do. So I'm going to go ahead and just hand this over to Patricia Yeager. She is the CEO of the Independence Center in Colorado Springs.
Thank you, Jen. I wonder if we could advance the slide, please. So I'm going to talk a little bit in a different language, perhaps, than what independent living centers are used to. I'm going to be talking about sales and marketing and our services and the benefits that we provide to the care plans or to the managed care plans or the hospitals, the medical establishment that are our customers. And the beneficiaries of our work is the patient, or what we would say the consumer. So there's a lot of things that we know that they don't know, and we know that they don't know about benefits or how the community works. We are a treasure trove of information to the care managers in the hospital, the discharge planners, and also to the managed care companies who are looking for people to do independent living skills training, peer counseling. We know that without acceptance of the disability and the changes, it's hard to move on, and we are masters at helping people do that. The managed care plans and the hospitals are not, and people are not successful until they get over that barrier. We do a lot of health promotion, whether we want to admit it or not. I'm thinking that many of you are doing living well with a disability. You're talking about chronic disease self-management. How are you taking your diabetes? All of those things impact health, and the managed care companies and the hospitals cannot reach out to the consumers like we can to follow up and make sure that people understand what they're supposed to be doing. It's a huge benefit to the healthcare arena, and they will pay for that. Assistive technology and durable medical equipment. Many of the centers have knowledgeable people about all the different kinds of technology and equipment, high tech, low tech, that people use. And that is very helpful to the managed care plans, and particularly to insurance companies who are having to figure out how is that person going to live independently in the home, and they don't have the experience that you and I do to know what helps, and actually to even know to talk to the consumer oftentimes. So, you know, that's an area where you can really I think, have a lot of fun and be helpful to the patient, the consumer, and to your customer, the health plan. Another one is case management. I really like the term service coordination, but the field is really looking at case management. We do that every day. We work with people, helping them to get their home set up, to get, you know, their Social Security set up, their other benefits. We do all of that. So it's not something that's unfamiliar. What may be unfamiliar is the intensity of it when you're coming out of a medical, an acute episode in a hospital. We are not often prepared for that kind of intensity and need for services. So we may have to look at that and plan for it. Next slide, please. Let's see where the next slide. Oh, there we go. So now, I'm hoping I've given you some ideas or gotten you started to think about services that you could sell, if I could use that word, to the managed care plans or even to the hospital. And I'm going to start at the bottom of that slide. The first thing we did before we pitched a program to our local hospital was I called around to Craig Hospital. I called around to other hospitals in our region and talked to the case management director and said, what are your barriers? What do you have to do to get a person with a disability out of the hospital in this case? And I gathered information about where their gaps were. Once I knew what their gaps were, then we sat down and looked at our services to say, now, can we fill those gaps? Do we have the staff? And we did a business plan. And we had to cost it out and figure out that perhaps the IL staff weren't the people to be doing intense case management and that we needed to hire somebody for that. We built it into the cost. So you really have to build your plan and know exactly what what you need to spend your money on and how much money you need to cover it. Then you design or create a one-page sell sheet on your services, and this can be very brief. It can be, I just did one for sort of a managed care company that said we're going to do disability competency training at this cost. We're going to do audits. We will offer audits, medical ADA audits of your practices at this cost, and we're happy to assess websites for 508 compliance. Those are the three services that we are selling to a sort of a managed care entity in our state. So the next thing, once you develop your list of services, you really have to build a case for how is it that you can impact health outcomes. In the example I just used, if people can get into the doctor's office and get on a table, their health outcomes are likely to be much better than if they don't go or they stay in their wheelchair for their exam. If their health care is better, their lives work better, and the health plan spends less money, and everybody benefits. So you really have to focus on the research that you did with the entity that you want to sell a service to. How does it help them? And in turn, how does it help the consumer, the beneficiary of the service? Consider adding things. When we got into our hospital-to-home project in the hospital here, we did not really think about how much benefit it would be to the existing case managers and discharge planners. And we've worked with over 50 of their patients, what we would call consumers, to help them figure out and give them information about community services, even though they did not need our services. That's an added benefit that every health plan and hospital can really use. So think about all the different ways that you reach out to the community, what you bring to the beneficiary, the person with the disability, that the hospital will pay for. They may not know they need it, but it's your job to tell them and show them how they need it. Let's go to the next slide. This whole approach is of looking for fee-for-service, and eventually it'll go to a different payer model altogether, but we won't get into that just yet because I don't even understand it. But looking for fee-for-service, you really have to have a mind that looks for opportunities. And by that, when you see a gap, it really is an opportunity. And how can you fill that gap? So the question is, what's missing in your community, or has your community, disability community, voiced a need? Is that need, if you impact that need, is it something that others would address? So if you're a managed care company, or maybe your hospital has a need for benefits counseling, and they have people who come in on Medicaid but not on the waiver program, so they can't get help in the home, there's a gap. Your clients or consumers are not getting the services in the home, and the hospital doesn't know how to get those benefits to the person. So that's a gap. You have that information. You can price it and sell it to the hospital to benefit the consumer. And then finally, what's really important is you got to know how much it's going to cost you to do that service. And put all your costs in there. You will probably come to a bottom line, and then I would consider doubling it at least to make sure that you cover any emergencies, contingencies that you haven't thought about. And then you're going to have to do some research around what's the cost to the managed care company, the hospital, that if they don't have that service. Are they having to spend more time with the patient, client? Are they having is that patient spending more time in the hospital than needed because they don't have access to the service? All those are ways that you can save the money for the paying entity, but more importantly, get a service to the consumer that is vitally needed to maintain their health. And we're all about maintaining health, both the hospitals, the managed care companies, and really all of you as independent living centers are about helping people maintain themselves in the home. So if you know your costs and you're researching the cost of the health plan, you know the program that you want to sell, it really puts you in the entrepreneur seat. And the fun thing about this is that really we're all about helping consumers become independent, often through a job. And this is about helping you, the Independent Living Center, become independent as well. So with that, I'm going to, let's see, do I have another slide here? I'm going to turn it over to Brooke, who will take us on down the path that we're following here. Brooke?
Awesome. Thank you, Patricia. So in creating the guide, we wanted to provide key steps to prepare you to work with health plans. And so the great thing about the guide, and I'm sorry, can we advance to the next slide? Awesome. And so the great thing about the guide is for each step, there's some great insight and additional resources that you can look to for guidance. So for the first step, we have prepared to expand your reach, so making a plan. And so this step really focuses on creating a business plan and also assessing the landscape of your community. The next step is prepare to engage with health plans and payers to improve health outcomes. And so in this section, we really talk about how the focus of health outcomes is really big for health plans and payers. The next step is shift organizational perspective to accommodate new reimbursement methodologies. So Patricia mentioned fee-for-service, but there could be some health plans and payers who use different reimbursement methodologies. And so this section will go into that. And so determine staffing for working with health plans and payers. So there's going to be some additional skills that you might need to acquire for your staff members or have your staff members learn. And so some of that would be like really someone who's able to assess and understand cost. So that's very important. And then in the next step, understand approaches of case management and health plans. And so really case management, and this was previously mentioned, it's really it's a key service that's purchased by many health plans. So this section will go a little bit more into that. And then establish or join contracting partnerships or networks. And so you'll really want to understand who are the health plans in your community that you can partner with. The next step is engage with state agencies, and then demonstrate in marketing how civil services support health outcomes. And this was something that Patricia did an excellent job of explaining how important the marketing aspect is when you're approaching these health plans. You're going to also want to secure necessary certifications and licenses. And so again, this is really going to be dependent upon what the requirements are for the health plan or the health payer. And then last, develop strategies to track progress toward goals. So this talks about really the data that should be being tracked, and there should really be a system in place to do that. And so I know you're wondering, you know, there are a lot of steps. Do I need to do all of these steps in this exact order? And the good news is you don't. So we just wanted to provide key steps for you to follow. We understand that every center's journey is going to be a little bit different, and so you can put the steps in whichever order you feel is going to be a good fit for your center. Awesome. And then so Orion is up next, and he's going to be discussing organizational shifts.
Thank you, Brooke. So as Brooke went through the list of items that would be steps that you would take in preparing to market your programming or market your organization, I think part of the conversation for most of us has been about not only how do we, but we have a lot of conversations about should we, and we have conversations about is it appropriate for us to be in. And so one of the things that as you explore opportunities for contracting with other organizations, as you explore the ability to pursue some of the business opportunities that's there, is to think about your organizational approach. And in some cases, that involves some shifts in your thinking about your programs and your services. Not a change in the service, but a shift in thinking about how you view what you do, how you measure what you do, how you describe what you do to others. So I was in a session in our agency, and we've been contracting with some of the local hospitals here in our community for nearly a decade for services. And the first conversations with providers very often I would describe those as being lost in process. We spend a lot of time talking about how we do things. So as trying to find an analogy for that is as if you are sharing a cake with someone, usually that conversation about that cake recipe you like is because you tasted the cake. That was really good. I'd like to know how to make that. And then you share the recipe. If you begin with the list of ingredients, you lose some of the impact when you talk about the service or the program or the benefit that's there. So as you think about within your organization and being prepared to take these steps, think about how you can focus on outcomes in your organization, not just the processes that you follow. Think about outcomes, think about the intended results, the reason why you do the things you do. That helps foster the conversation, to help you explore how to accomplish your work, accomplish your mission through different payers, through different environments perhaps than what you have done previously. Similar work, same staff most likely, but how you might present it or describe it differently. Think about the regulatory environment that you are in. What is of interest? What is of value to the other players? In our community, one of the conversations we had was specifically about emergency room use and hospital readmissions. Those are quality indicators for a health plan as well as quality indicators for a health system. And to be able to explore how your activity impacts the frequency of someone ending up in the emergency room is a good example of an outcome that you obtain through your programming that's of interest to someone else who might not currently be part of your funding stream. As you think about exploring those opportunities based on the outcomes and the results and the value that you offer, and that can help you explore not only who the potential partners in the community might be, who the potential customers or payers might be, but also to think about the licensure or certification or credentialing that might be required. So, for example, in your current environment, as a Center for Independent Living or an Area Agency on Aging or an Aging and Disability Resource Center, a big part of your identity has always been that definition of you as a Center for Independent Living. And there's a certain status that comes with that, a certain expectation that comes with that. And in some ways, you operate as somewhat of a protected monopoly. You have a clear, identified goal, very often a goal that's identified in statute or regulation in your state. But if you didn't have that particular piece of credibility as part of your process, you would still have credibility and standing in the market because of the expertise you have, the experience you have, the market knowledge you have, the consumer knowledge that you have in providing that. So as you think about your organization in this new space, think in terms of not only about the processes you have, the products you currently have, but think in terms of the value you provide to others, who has an interest in building that or promoting that, and also who is likely to be a potential partner, a potential collaborator in that process. The other thing I would say in this space is that sometimes the thing that you value in the exchange may not necessarily be what the other provider values. The thing that you find to be most important may not be the thing that catches their attention, but it's still a reason to partner with you. Within our own agency, one of our programs in Indiana required our staff to be in hospitals regularly as part of the process of screening people for nursing home placement. The staff that was in those buildings was not there as a resource person to the hospital for general information about programs and services through Medicaid waiver programs in the state. But they were staff members of ours. They were familiar with our programming. They became that conduit. We discovered the value of that accidentally, because when a regulation changed and our role in that process changed, it did not require our people to be in the building as much. But we have heard from the hospital since then that they missed their resource person. Well, and so understanding and appreciating that sometimes the value you add may be more evident to the consumer than it is within your own agency And in our case, that was a question of our looking at this from our own process perspective, not necessarily looking at it from the perspective of the consumer, the community partner involved. If we could go to the next slide, please. So the other factor to think about beyond the value that you have or the regulatory environment that you have is also to think about the staffing requirements that come into play in this different environment that you enter into. There's a concept in the book Good to Great about having the right people on the bus, and this idea that you want to make sure that you have good alignment between the skills of your personnel, your staff, with the work that you're asking them to do. Very often for agencies like ourselves, particularly in sort of our traditional sort of grant-funded environment, we did not think as much about the transactional processes that take place, but those become important if you step away from the sort of regulated monopoly that we operate in into these more entrepreneurial or more market-driven kinds of space. Do you have a person on staff with skills in sales and marketing? Do they have responsibilities identified that they have responsibilities for sales and marketing, so there's an understanding of where that performance expectation can be and should be? As you enter into these competitive environments and understanding cost, do you have folks in your finance or business office that have some acumen in that space that understand about the difference in the dynamic of reimbursement from a grant versus the managing your payables and receivables with an outside vendor? So, looking at those new skills or new experiences that may be required. You may find that those people exist in your agency and they've just not been tasked with that responsibility. Very often we do have folks who work within our organizations that are drawn to the mission who come to us from a background with a healthcare provider, with a business organization, with other opportunities. So look for those folks who have appropriate experience, appropriate expertise in that space, and if you are fortunate, you will find that often those folks exist in your organization already. Look at those skill sets and see what is required there. It is a different work environment, but there are many opportunities for consistency with your mission, with enhancement of your mission as you find new ways to bring other folks in to collaborate and partner to help you reach the folks that are the target of the mission of your organization. So with that, I want to turn the conversation back over to Brooke, who's going to talk to us a little more about the guide.
All right. Next slide, please. Thank you. All right, so where can you find the guide? So the link for the guide is up. It's on the Aging and Disability Business Institute.org, so you can find it there. And again, I just want to reiterate that this is going to be a live document. So our plan is to continue to add resources and materials that will be beneficial for centers and other community-based organizations throughout their journey to working with health plans and payers. And then if you have any questions about the how-to guide, you can contact ILRU at ilru@ilru.org. Okay. And now it looks like we're going to go into the Q&A period. So if you have any questions about the guide or about any of the content that was covered, please feel free to submit your questions, and we will be sure to answer them. So it looks like we have some questions already in. And so one question says, from Renee. If we offer case management services, will it not require sales staff to have a degree? So Patricia or Orion, do you want to take this one?
Go ahead, Orion. Go ahead.
So, from part of the question, part of the answer to that is what is the regulatory environment that you're operating in? Not all case management or care transitions programs require specific degrees. So, that I guess my quick answer to that is a little bit. It depends on the service that you are extending.
And this, Patricia, I would agree. We don't operate. We are not an employee of the hospital where we're doing this transition coordination. So they haven't asked us about qualifications. They assume that we have qualified people as we determine that to be. We are not required to have any kind of certification. I'm thinking of the other programs. We do one for the VA that does not require, they don't ask us for our qualifications for staff. So it really depends on the organization and how, how close you are to the organization. Managed care companies and hospitals, yes, they do hire people with certifications, but contractors, and maybe not so much. It's a question for the company or the entity that you are presenting this service.
Okay. Thanks, Patricia and Orion. So our next question it says, in Ohio, we have had almost no luck with getting contracts through our MCOs. I have offered that they contract with us to do outreach for home care providers. The MCOs say they cannot do that. So what advice or recommendations do we have?
Okay, so I read this that earlier and have been thinking about it. The managed care company may have to just give out a list of home care agencies. Maybe they have their own home care agency and they're not allowing anybody else to touch that. I guess I'd be looking for a mole. I'd be looking for somebody in the managed care organization to sit with you and talk about what are the gaps in services they have, what challenges do they have, and go at it from doing the research and meeting their needs. You might talk to someone else. Is there anyone in the community that they do contract with? If so, then I would take that person to lunch and pick their brain. How did they get that contract? And what services? How did it all work? And learn from them. But it sounds like you may need to go back and do what we would call a needs assessment of what are their gaps and look at it that way.
I would add to that perhaps the question might be maybe the service that you are trying to sell them is not the service that they want to buy.
Right.
So a great local example. There's an organization that we work with that is effectively it is a family support program for families that have children with disabilities. They're not a licensed agency. They are in a lot of ways they are an enhanced support group. But they are particularly adept at helping families navigate the complexities of the healthcare system when they have a child with special needs. And they have contracts locally with 2 of the managed care plans that serve the population through some of the Medicaid programs. And sort of they have become a translator, they have become a coach kind of environment. And those are not menu items that exist on the health plan, but those are things that the health plans have learned that they offer better quality, they have better enrollment, they have better outcomes among their covered lives by engaging in those kind of programs. So what you might look at is in approaching a managed care entity in your state would be, is there a managed care entity that is struggling with a quality measure in their particular category? There is some information that you can find about the ratings of the plans, the evaluation of those tend to be public record. Sometimes you have to do some digging to find it. But are there deficiencies in their system that you could come to them and say, I can help you with this quality measure. You have this score that's not where you would like it to be. We can help you with that. Here's what our approach would be. So it may require you to think outside of your current program and service mix, but thinking in terms of the standing you have in your community with the population you serve and how that might be helpful as a navigator, a coach, a transition guide, and what that might look like. And that may help open that door as well, because you can fulfill the need of that potential customer, the MCO.
Okay, great. Thank you both. And Lisa has a question. She says, how would you go about finding out what the cost is for the health care plan? So I think this is in reference, Patricia, when you were discussing knowing the cost of services, knowing the cost to health care plans of services.
Right. So the hospital-to-home program, where we help people with disabilities go home rather than a nursing home, and provide 30 to 60 days of wraparound services, both medically based, home health care, and IL based. And so we did a plan of how much does it cost if the person had insurance, if they had Medicaid, if they had nothing, and we estimated how many hours of home health care, how many nursing visits, estimated how many OT, PT hours, that kind of thing that might be needed, and we set up straw people, if you will, example cases of how much it might cost. And when we put it all together, and we have partners who also provide services, and we got their price, we figured out our price, which was considerably lower than the common knowledge in our region, that it's a hospital bed. To spend 24 hours in a hospital is $1,500 to $2,000 a day. And we, in our calculations, the worst case scenario was $300 a day for us to be able to do those kinds of services. So that is a published price. You again need to have somebody that I think there are more and more. There are the states are holding hospitals and others to be transparent about their costs. You could go to the state and see if they have any cost information. It just depends on what the service is you're trying to offer. If it's case management, well, you can kind of check out their employment line and see how much they're paying their case managers. That's one way to look at it. Excuse me, and you're going to have to research it. But it would be helpful if you had a comrade somewhere in the health plan or in other agencies that have worked with them to be able to find out how much does it cost. For us, we were looking at beating the cost of that the hospital had and keeping that person in that hospital bed for 24 hours.
Okay.
Does that help? I hope that helps.
That's great. That's great. And we have a question from Janice. Will offering fee-for-service services subject agencies to HIPAA guidelines?
So if you are handling medical information for clients, you likely are already subject to HIPAA guidelines. The act of contracting for a fee does not change the content of the information that you handle. That in and of itself would not be the reason that you would have to be HIPAA compliant. There are organizations that provide a service to someone who gets the service because of some medical issue, but that agency doesn't necessarily handle the medical information. So, for example, a transit provider that provides transport to medical appointments doesn't necessarily have to have, is not necessarily subject to the HIPAA guidance. It depends on what kind of information is shared with them or provided with them. You should have your legal counsel review that question and make the determination about what is required and what sort of protections or agreements need to be put in place between your organization and the contracting entity as you enter into those kinds of programs.
I would add to that, we are, as an independent living center, we are HIPAA compliant. We have different levels of it. Our home health and the hospital to home have the highest level of HIPAA compliance. But even downstairs, when somebody's doctor statement comes across the Xerox machine, we got to make sure that it's not out there for everyone to see. So you're probably already doing some HIPAA compliance. I wouldn't let that scare you.
Yeah.
Okay. And we have another question in from Judy. In Texas, Sills and 2 other CBOs are providing relocation services under contracts with Medicaid MCOs beginning our 2nd year. Do any of you know of other similar contracting activities that we could contact?
Okay. Say that. Could you read that again?
Yes, I think they're saying that there are other providers working with MCOs to provide relocation services, and so they're wanting to know maybe other services that they could approach these MCOs about,
okay,
that they could provide.
So, Richard Petty, this might be something that that ILRU could collect information. When you say relocation, I'm thinking you're meaning transition out of hospitals or nursing homes, and yeah, I think that that information could be something that ILRU could provide. There are a number of folks that are doing, particularly out of nursing homes. I'm only aware of 1 or 2 that are doing hospital to home as independent living centers.
But indeed, that's something that we at ILRU can do. And I was listening to that question as it was read, and I wondered if they were looking for other MCOs that were, in fact, wanting to pay for transition, and we could get to that through other centers that are doing that. And it's worth reaching out to the MCOs, for the center to reach out to MCOs in Texas, which is the state where you're located, to reach out and find out. That'll be a matter of public record of which MCOs are in operation, and finding out they're interested in doing that within your own area also.
Thanks, Richard. And we this might be the last question since we're running a little short on time. So Michael asked, as Sills staff, how can we promote the concept of empowerment in non-case management if we are expected to fill a case management role by MCOs?
Well, I guess I would say you need to define case management with the MCOs. When we do case management to transition a person out of the hospital, we meet with the client first, the patient, the consumer first, and get an idea of what he or she wants to do and where they want to go. We include the family. It's very independent living, person-centered driven, so I'm not sure. It depends on the definition of case management. It's not where we go every day and hold their hands and take their temperature. It is where we check in with them and see what their needs are and help them move the continuum.
And this is Richard Petty. Certainly what Patricia says is entirely on point, and that is negotiating what case management includes. Another point that's very important, case management delivered through a consumer-directed organization is going to be far more useful and far more successful than case management delivered by an organization that's not consumer-directed, that doesn't practice consumer direction in its approach to services. So there are great advantages for centers to be involved in case management.
Let's show them how to do it our way, the person-centered way, because I think professionally trained case managers come with a preconceived notion of what it is that you need. Mr. or Ms. Patient, and independent living centers do not come with that. That is really the basis of the difference.
Awesome, thank you. And Steve, do we have time for one more question?
Yes, of course.
Okay. And so another question in says, from Daniel, have you seen any data that shows the effect that home modifications have on health outcomes?
I haven't seen any research out there, but I'm sure the research and training program at Georgia State would have that. They have a research and training program on assistive technology, home modifications, that sort of thing. They might be a source of that. Yeah.
So on a very micro basis, because we do home modifications through Medicaid waiver services in Indiana, and then our agent does these with philanthropic dollars for folks that do not qualify for the Medicaid programs. And the particular place that we have focused on a measure for that is falls reduction. And so, again, small set, but looking at the impact of a home modification in terms of reduced incidence of falls compared to the general population. And particularly, falls tend to be a reason why someone ends up in the hospital, ends up in the emergency room. And so we have been able to point a reduction in the percentage of folks with a home modification having a fall versus those who did not have a home modification at all. So I have to take some of that out, but I think if you look, states have a coalition of sort, and you may be able to knit that together from your home modification efforts and looking at fall risk reduction of fall risk as a way to develop that. That's the we approaching, particularly on the grant-funded side.
Okay, great. And we have plenty of questions that are still coming in. Steve, are we able to continue?
We've reached the end of our hour, so unfortunately we need to wrap up.
Okay.
All right. I want to thank our presenters for being here today with us. Richard, Jennifer, Patricia, Brooke, and Orion, thank you so much for being here and presenting.
Thank you.
Thank you.
Time for us to wrap up, everyone. We've reached the end of our hour here. If you want to receive CEUs for today's webinar, please just sit tight. You will be receiving a follow-up email later on today with a link to the CEU application as well as the slides. Thank you for joining us for today's webinar, which is part of the Aging and Disability Business Institute series, a collaboration of N4A and ASA. Have a great rest of your day, everyone.
Richard
Yes.
Petty here. As we conclude, if there are unanswered questions that if you would like to send them to ilru@ilru.org, we'd be pleased to work on answers to those questions for you.
Okay, good to know. Thanks, everyone. Time for us to wrap up. Have a great rest of your day.